Recovery after surgery can be a scary thing for people. Some people are having a lot of pain, really slows them down. They don't want to move, but we want them moving. Other people, the recovery with some of the newer pain techniques that we have can be more of a straightforward process. Most typical thing is the first 2 weeks, a lot of people definitely have pain. It's probably when you hurt the most, is really the first 1 to 2 weeks after surgery. And when people hurt, a lot of times they don't want to move, but really what helps them the most is if they get moving. A lot of times this is not that you're going to go out and do 3 hours worth of exercise, the day after surgery. This is you're doing 10 minutes of your knee exercises, and then you're doing some limited activities around the house, and you're slowly starting to get moving. We get you into an outpatient therapy typically, especially with knee replacements, and then once we get going with outpatient therapy, usually by 2 weeks you're starting to get outside, you're starting to do more. Typically by 4 to 6 weeks, most people are driving after hip and knee replacement, and so it's a slow and steady recovery for everybody. Some people achieve goals quicker than others. Most people though, the first 2 weeks are the toughest, and then 2 weeks to 6 weeks are when you're really starting to kind of come back to life, and then usually 6 weeks to 6 months is when people are in a very steep recovery curve. They're making a lot of functional gains, getting endurance back, muscle strength's rebuilding, they're learning how to walk again, they're just really starting to regain a lot of their life back. Most joint replacements, though, it does take up to about a year to fully recover from. And a lot of people are surprised to hear that. They think they're going to get it replaced, and a month later they're going to be back to normal. And that's one thing we talk to our patients on a regular basis about. This is a process. It's a marathon. It's not a sprint. And so the recovery process really takes time. I think anything worth doing is going to have some challenges, and I would be lying if I didn't tell you there will be some challenges out of the gates. Again, the pain is going to be there. We do a surgery like this, you're going to have pain. We have a lot of new techniques to help mitigate and improve that. We use a multitude of different types of pain medicine, a lot of them non-narcotic. And once your people are feeling better with their pain, they start doing more. And then usually once they can see that they can actually do these things after surgery, it motivates them and gives them confidence when they go home.